Okay, good afternoon and welcome back to the final keynote in this symposium. We have traveled quite a bit, and as Professor Chaudhary said, sometimes we travel through a certain terrain to exit that terrain, and there's a certain critical movement of thought there. We have discussed, traversed, and also exited quite a few terrains, and it will be a new terrain that we will enter into in this final keynote. And it gives me great delight to introduce Professor Debashis Bandyopadhyay, and I've been fortunate enough to be taught by him in Presidency College, Kolkata, a long time back. To introduce Professor Bandyopadhyay, Professor Debashis Bandyopadhyay is Professor of English at Vidyasagar University, West Bengal. As a Fulbright scholar, he worked as a faculty researcher at California State University, and as a Charles Wallace postdoctoral fellow, he pursued research in St. Anthony's College, Oxford. He has also been a visiting professor at Mexico and the USA. His research interests include psychoanalysis, literature, and cultural practices. He's widely published in India and abroad, and his books include Locating the Anglo-Indian Self in Ruskin Bond, Anthem Press in 2011, Imperial Maladies from Nova Press 2012, and Connect from Cambridge University Press 2018. And Professor Bandyopadhyay today will again perhaps bring us closer to this medical approach as one of the strands we have been discussing in the symposium. And his paper is titled Pre- and Post-Operative Trauma in Women Diagnosed with Breast Cancer, a Psychoanalytical Approach. So over to you, Professor Bandyopadhyay.
Thank you, Orko, for a very kind introduction. This entire thought, this is a new and a virgin territory for me, actually, that I worked on, and it was mainly triggered by a sort of, on a subjective, very subjective note, because one of my students, who is an MPhil scholar and a very committed scholar, I came across this person, and she started crying one day in front of me because I gave her some work which she required to do very fast. And then I came to know that she is under extreme duress. And then I asked her what had happened. Why are you taking it in this way? And then she said that I often travel to Mumbai, from Kolkata to Mumbai, and come back because my mother is diagnosed with terminal breast cancer. And immediately after that, it was so sad that his father too was diagnosed with pulmonic cancer, lung cancer. Then I thought that I asked her, in what state of condition is your mother now? She is okay now, but then she is deteriorating fast. Then I wanted to have an appointment with her mother, and her mother came up to my place, and I started questioning her what were her traumas, what is she feeling now? Because I had a sort of a subjective, complete subjective sort of a emotional engagement with this particular girl, in terms of she is almost the same years as my daughter, and what came out from this conversation itself was very intriguing, out of which this particular hypothesis of trying to use psychoanalysis or Lacanian notions, Freudian Lacanian notion, to understand what is actually happening within her at that moment. She had forgotten that at one point of time during the moment of adjuvant chemotherapy. Adjuvant chemotherapy is once you are diagnosed with breast cancer and you have had a sort of an invasive surgery, that means either a partial or a complete mastectomy had taken place, thereafter you had been given adjuvant chemotherapy. The effect of adjuvant chemotherapy becomes very, very dire on especially women, because some of the typical, stereotypical and traditional ideas of beauty getting deteriorated fast and faster because of this. I asked her that what was your problem? That means, were you really traumatized because of pain that you had suffered, the kind of sense of fatality that you were suffering from, or it was more a sort of a filial emotions? How would your daughter grow up, because she had the only daughter, grow up? She said that all these were there, but there was something more than that. Then I said, after the chemotherapy began, your body started taking massive influence of that. What was happening at that point of time? She said, I don't remember exactly, but there was a sort of something happening within me, but I couldn't. She's a professor as well. But she couldn't tell us in exact words what was that something happening to her. Her daughter helped me. She was with the mother, said that this is exactly what was happening to you, mother. That means you were living in a condominium, in a complex. At one point of time, before that particular chemotherapy took place, there was one state of mind that you were suffering from. After the chemotherapy began and it had a massive influence upon your health, another influence started taking place in your mind. You became very fastidious about the way you have been gazed at, the way you have been recognized by the people within that particular community. That means even the drivers within that complex, the sweepers, the janitors, and even the people who used to live as neighbors within that complex used to take umbrage to her look. She had a sort of a resistance from them. They even did not listen to what she is trying to convey or trying to speak. Not all, but she felt this. And some of them moved forward with a sort of a sympathy which has a little bit of disgruntlement or a sort of an animus about it. So she could really feel that she is being alienated because somehow her hair is growing thin, the different curves of her bodies are not working anymore. She is moving towards a sort of elderliness. These sorts of things made her very conscious about her own identity from the point of view of the other. Then I started working on this hypothesis that does this Lacanian notion of the gaze really have that sort of an effect upon the self? Lacan at one point of time says that desire is the desire of the other. How is this particular other formulated? What is this particular other from the point of view of the gaze? He speaks about two particular objects in a very minimalist sense. These two kind of objects can be framed in this manner, that since I am a person who belongs to a community, that particular community's relationship with me, it constitutes these two others. One is my desire for this particular other, which is a small other. At the same time, I desire the desire of the other for me, which is the big other, which yesterday we were speaking of in that particular session of the panel session, is actually the community, the institution, language. But this big other is also the gaze with which I am fixated or formulated constantly, which has a traditional historical effect about it. The woman is expected to be desired by the other in a particular manner. And this is a traditional thing. In what particular manner the other wishes to look upon the woman is prevaricated by a number of pictures that I'm going to show you, which will tell you that from the old Greek period to the present day, to the 21st century, there had been more or less a sort of a stereotypical way of how the other looks upon the feminine other. Let us take a review of the ways in which the woman in sculpture, in art, and in actual social life were framed by this big other. This is a picture of Aphrodite made by the Greek sculptor Praxiteles in 350 BCE. If you look at why I'm showing this particular pictures, because it has a direct relationship with the kind of therapy that is administered for breast cancer patients. We will slowly come to that, but let us first situate the notion of the big other's notion of desire of the feminine other in terms of history or in terms of affect. See how this particular woman is described as having very rounded curvatures. The woman's busts are very prominent, the thigh is very rounded, and she has all the more a sort of a rounded and a complete and a filled up feature. Next, I go to a Chola, 11th century Chola painting in which Krishna has been, one of the gopis of Krishna has been described. See again how the shoulders are rounded, how the breasts are made more focused, and how even the face, although not that rounded, but still have a roundishness about this. Just observe the characteristics of these particular women. So this is an 11th century painting. I had already shown you a sculpture of the 350 BC, and also spatially a time, spatially a place which is far distant from India itself. Here you go to the last picture of these three triads, where you see a Chola. This too is a Chola painting of another Apsara, where the half picture that you have seen has become a complete picture. Here too you see particular parts of the body has been focused and had been actually underlined. This is a late 15th century version, characteristics of how a woman from the notion of the other, from a masculine notion, has been framed. This comes in Sri Rangarashtra of Bharitrihari, a face to rival the moon. This is a translation. Eyes that make mockery of lotuses, complexion eclipsing gold's luster, thick traces that shame the black bee, breasts like elephants swelling temples, heavy hips, a voice enchanting and soft, the adornment in maidens is natural. See, some of the characteristics overlap from across time and across space. This is slowly becoming a sort of stereotype of the woman. But why is this? We will come to that slowly. This is the famous painting of Lucretia by Paolo Veronese, of the Renaissance painting by Paolo Veronese. Here too you see the woman having rounded curvatures. Even the face and the cheeks have become very rounded. Almost the same tradition is continuing. We have now come to the 16th century in Europe, where we see Paolo Veronese's famous painting of Lucretia. This again is a Victorian painting. We are moving from the Renaissance to the Victorian. In the 19th century, the famous picture of La Nuit, which is the picture of night, which has been drawn by William Bouguereau. Here too you find those particular features that you have actually seen, the rounded shoulders and the curvatures of the body, with the busts being very focused. This is a postmodern painting, very postmodern painting, where the busts have actually been made up by artificial means, and this particular woman, or the picture of this woman, acts as a sort of a pin-up, which anthropologists say, as a pin-up model, which anthropologists say has those particular focuses within the body, which is quote-unquote typically feminine, especially those particular parts of the body which we will look upon more as creations of the notions of fetishes in the absence of the Freudian notion of the phallic. Now we come to why these particular pictures have been shown. During breast cancer, one of the reasons why breast cancer spreads very fast is the action of a particular enzyme which is called estrogen, O-E-S-T-R-O-G-E-N, estrogen. Estrogen, apart from creating or multiplying the mammary glands within the breast, estrogen has multiple different actions in a feminine body. Estrogen is also secreted by the males as well, but estrogen doesn't have a very proven action within the male. What are the other different actions that the estrogen performs? One of the very important action that the estrogen does was enlargement of breasts and erection of nipples. The next one is growth of underarm and pubic hair, development of thigh muscles behind the femur. These are all feminine characteristics which I will slowly move to as objects of the other's attention. Why? Widening of hips. These are all activities of the estrogen. Smaller waist. Face becomes more rounded with softer features. This exactly conforms to the sculptures and the paintings that have actually shown from 350 BCE to the postmodern period. Then fat deposits mainly around the buttocks, thighs, and hips. Increase uterine growth. Increase vaginal lubrication. Estrus or sex drive is dependent on androgen levels only in the presence of estrogen. And this is also complementary to the growth of the ovarian follicles. That means if you don't have estrus, the ovarian follicles won't grow. So naturally, childbirth would become very difficult. So yet another very important complement is being added to the notion of beauty, which is the normal feminine notion of bearing a child. And what does a child do to a particular woman, to a mother? Lordosis, or metaphoric thrusting of the buttocks, Helen Fisher's interpretation of women's high heels. Lordosis, generally human beings do not, during their sexual activities, do not have a lordosis posture. This is a typical non-human posture, or better to say animal posture, lordosis, where the buttocks are raised up during sexual copulation. But according to Helen Fisher, a very important anthropologist, she says, makes a very important observation, that women wear heels in order to thrust their buttocks up. So even in the Victorian period, where the ubiquitous use of corsets were used in order to pronounce the breasts and pronounce the busts and make the breasts normal, even bustles were used in order to pad up the buttocks. So heels which actually project the buttocks makes, from the other's point of view, the woman as an object of psychosexual desire in many ways. That is why the point of lordosis has been used. And this particular bustling, artificial bustling of the buttocks actually take place with the accumulation of fat in the hips, especially because of the use of estrogen. This is Helen Fisher. Now, when a particular woman is diagnosed with breast cancer, the first thing that the doctor actually administers to that woman is estrogen inhibiting drugs. So once estrogen inhibition starts taking place within the entire body, it spells upon the woman's beauty, the traditional notion of the woman's beauty. That particular notion of the fixation of the gaze is slowly being contorted with the action of this particular estrogen. That is why I showed you the body. But what is this particular notion of these objects of the different elements of the body doing in the case of a woman? That is exactly where the complication comes from the Freudian and the Lacanian notions. Freud uses this particular term phallus, phallic notions of sexuality, but then phallus is not exactly, from Lacan's point of view, is not exactly the organic part of that body, which is the erotogenic part of the male organ. It is a sort of a symbol which does not actually exist at all. If it does not actually exist, then the man too suffers from a castration complex that Freud actually speaks of in his Femininity, in the way in which a woman suffers from the notion of castration too. That means from which actually the notion of the fetish grows. Fetish is something that once you look upon that particular other as a feminine other, you try to imagine that particular absence is not there. That means the organic part of that particular woman, he has that particular organ which the man has. But since it is hidden, the exterior part of the body, which actually can act as a sort of a replacement for that actual absence, becomes a sort of a fetish. This fetish can act in the different parts of the woman's body. We had been discussing about what exactly the body does. The different parts of the woman's body can actually supply as a sort of an absent fetish to the other's point of view, which not only restores the woman's identity as a phallic object of desire, but at the same time restores within the man a sense of alleviation of the trauma of castration. Because a man would think that if the woman can exist without having it, it might not be an organic part of the body. I might lose it at any moment. So the man tries to escape within the woman's body an absent notion of the fetish in order not only to give an identity to the other, but at the same time restore his own sense of identity and alleviate the notion of castration. So this fetish is a sort of a double image that is constantly working within the mind of the feminine object of desire and the masculine mind too. Both are reciprocally and mutually connected with each other in terms of looking at the woman's body with those fetishes extant, at least as a sort of a supplement for the actual absence of the thing. So what are these fetishes? So from 350 BCE onwards to the pin-up girl, postmodern pin-up girl, the pictures that we have shown, the fetishes are not only the curves, but the three most important fetishes are, of course, the woman's busts, the breasts, the ovary, or better to say the uterus and the ovary together, which creates the uterine supplement, which makes the particular baby, the womb, to be formed, because the baby or the mother-child relationship actually creates the most important notion of a supplement of the absence of the thing. But the mother can also be looked upon as a phallic organ, the child can be looked upon as a phallic organ. And at the same time, those projected parts of the body, which becomes the object of the fetish. Now, for a woman, let's see what is after that. There are different kinds of breast cancers. This is the mother of my child, that means who is working with me. She is called Vaijayanti Ganguly, whose condition is now terminal, from which this particular entire thing actually developed, this idea developed. Now let us problematize this condition of the notion of the fetish and the other's desire of the woman from a little bit of a Lacanian point of view. What is this desire of the other actually? What is desire? Desire for the other actually is. Lacan says that a man's sexuality develops, male sexuality develops in a particular way which might not be, or which is not the way in which a female sexuality actually develops. There is an intervening order that takes place in the development of the female sexuality after 18 months of age. But Freud had actually thought that the woman's sexuality is actually phallic because the woman and the man both have it. Have it means have the male organ. The woman's clitoris is looked upon as the male organ, and the man's organic thing is looked upon as the organ. So Lacan, however, problematizes it further, saying that a woman's sexuality is immeasurable because it is not entirely dependent upon that particular phallic order, which is the clitoric notions of sexuality. Because the woman's sexuality is immeasurable, it does not actually has a gradation at all. And he speaks about yet another kind of a sexuality that a woman has, which is to some extent transcendental, but then is very much posited within the notions of femininity itself, but not exactly the masculine form. So the woman, according to Lacan, might have a double image, which is one of which, of course, is masculine, the other, of course, is feminine. And he draws a particular picture in order to describe this particular idea of a woman's sexuality, which can be connected with other ideas of Lacan, which he develops in other particular places. I will first draw the picture of how a woman's sexuality and a male sexuality are constructed by Lacan within this picture, and then refer to yet another particular idea of Lacan, which in Icris he develops as the L schema, the lambda schema. This is how Lacan, in feminine sexuality, in a particular essay, he describes the notions of a woman's sexuality. This particular picture, I think, from my point of view, would give us a sort of an instrument or a handle to understand how a woman can have or undergo a therapeutic what they call sessions in order to get rid of the trauma of these particular notions of expectations of desire of the other by sublimating it. There is a potential within a woman of sublimation which is not possibly available to a man because of this double image of sexuality of a woman from Lacanian point of view. This transcendental but at the same time feminine notion which is not exactly masculine. He says if this is the masculine part of it and this is the feminine part of the notions of sexuality, this is the subject. We have talked about the notion of the subject in discourses in the sessions already in last day's sessions. If the subject is the male subject, which of course is barred, this particular subject's desire for the other, which is the feminine other, which can be the feminine other if it is arrowed like this as alpha over here, that means the little object. If from the man's point of view it is the little object, it is almost like you are walking down the street, you are seeing somebody coming from the other side, you even don't know him or her. This happens both for a man and a woman. If that particular person does a sort of a grimace at you, you understand that your entire identity is fractured into smithereens. Why it happens? Because you are desiring that stereotypical other approval of yourself. So at first, your desire for that particular other is constructed by the male gaze upon this particular feminine other. But this particular desire of the other, or this particular objectpathia, or this particular object of desire is again a very fictive notion, because no sooner this object is created, this object is invested with an idealism which language might create, which the big other might create in order to help you with the investment. So this is not the other that this particular subject actually chooses. He invests a notion of idealism upon that particular object to create what is actually called the thee. This is the Lacanian part. In Lacanian parlance, it is called thee, the woman, which is the ideal woman, and which too does not exist. That is why he blocks it with a bar. In a lambda schema, this is almost like, in a lambda schema, it is like a lambda. It is like a lambda like this. In lambda schema, say for example, this is the subject, a person over here, which is the object of desire, but no sooner does he desire the object, he is investing that particular object with a fictime, which I was speaking of the other day, an object which is called a fictime, which can also be looked upon as a phi over here. He actually uses this, Lacan uses this in the reading of a particular film called Vertigo, which I was speaking of yesterday, where if I tell you in short that particular story, Lacan has been using these particular films in order to adapt them as a sort of a structure for his notions of psychoanalytic answers. In Vertigo, a Scotty Ferguson, a retired policeman, has been engaged in order that the wife of the man, who was the man, Orko? The man's name, I just forgot. It got out of my head. Anyway, Gavin Elster. Yeah, Gavin Elster is a man who actually engages a retired policeman in order to track his wife. That means Gavin Elster's own wife. Now, Gavin Elster actually killed his wife. I'm not going into the details of it. He had killed it's the Alfred Hitchcock film. So this ace becomes Scotty Ferguson, who is the policeman. The policeman is going to track Madeline. That means Gavin Elster's wife, because Gavin Elster's wife has been behaving in an abnormal manner. And Gavin Elster wants that his best friend, the police officer, should track his wife and bring her to normalcy. So that is what the policeman was doing. But no sooner does the policeman gets engaged in that particular act, the policeman falls in love. The retired policeman, Scotty Ferguson, falls in love with this particular woman, and he starts thinking her to be the ideal object, who is Madeline, and this woman was called Madeline. But at the end of the story, without getting into the details of the story, this particular woman dies. This woman who was called Madeline dies because she commits suicide, or at least Scotty Ferguson thinks that she had committed suicide, but actually she had not committed suicide. She was not actually Madeline. Madeline was somebody who had already died, and she was simply doing the role of Madeline. This particular object over here is Gavin Elster, who is constantly creating a falsification of the notion of the subject. That means the subject, his desire, is constantly being falsified by this particular man, hoodwinking this particular man to perforce invest a notion of idealism upon the actual organic flesh and blood object, which is an idealism. So this is how the subject's desire for the object is actually invested with an idealism in this particular story. So if this becomes that particular graph, what is becoming is there is a sort of a dotted line over here. I'm just simply taking this particular graph and putting it over here. The subject's desire for this is finally being idealized in the woman, the idealized woman, who actually does not exist as it did not exist in the case of the vertigo scene. This particular the's desire, however, is not reciprocal towards this particular subject, because this subject itself is not working. However, this particular woman can desire for its phallic satisfaction for a man over here, for any man over here, or any other over here, which is the phi, which is the phallic counterpart of a desire, whereas the transcendental part of a desire can move towards the northwesterly direction, towards this direction, and form, according to the diacritic used by Lacan, a sort of a S-O dash, O dash. This is the transcendental desire, which is called the vaginal desire for the woman. There are multitudes of examples in literature and, of course, in art, where a woman desiring a binary tropes for her sexuality or multiple tropes for her sexuality. Those who are literature students over here might be remembering in Emily Bronte's novel Wuthering Heights, the Catherine was in love with Heathcliff, but she married Edgar Wilden. In, for example, the famous film Breaking the Waves by Von Trier, it was an oil rig man whom this particular woman falls in love with, but when the oil rig man returns, and she finally marries her, but when the oil rig man returns to her wife with a complete, what you call fracture of the body, which an accident that she meets with in a particular oil rig factory, she tells the woman to her wife that I can't satisfy you any longer, but at the same time, he inspires this particular woman to go and have sex with other men and come back after having sex with other men to report to me your experiences. So, which is these two particular orders? Just to give you two examples, one from a canonical English literature, literary text, who is Heathcliff and who is this Edgar Wilden? Who are they? Which is, she finally marries a father-like figure called Edgar, actually this particular woman Catherine, but what was Heathcliff doing to her? So these are the examples which tell us that this particular desire of the woman, because of these two, at least two different kinds of sexualities, are driven towards a normal quote-unquote a normal phallic order, and perhaps a sort of a transcendental order. This particular order has many components according to Lacan, many phases according to Lacan. And among these phases, one, however, he says, what exactly he means by this, we don't know. He says, could be divine, which is very unlike of Lacan to make this particular comment, that one particular phase of this is O dash could be a divine notion, a kind of experience that I was telling to Shomojit and Autre yesterday, that happened in one of the literates' life, that is Yeats's life towards the end of his life, W.B. Yeats's life towards the end of his life, when he was in Majorca. A beautiful woman from Ireland comes to stay with him, and she finally returns back, lying upon that particular shore of Majorca in a state of a trance, and constantly speaks the lines of W.B. Yeats. Perhaps this could not be analyzed. Nobody could analyze this, because Lacanian psychoanalysis was a kind of enjoyment that the psychiatrist did not have for this particular woman. Perhaps it could have been analyzed that she might have had a sort of a transcendental idea of jouissance. So two kinds of jouissance are at least the combination that we find in a woman, which is perhaps not available in a man, at least in a normal order. But signification, I would ask, what was the kind of signification that Joyce actually uses with the letter that in Orko's book we were talking about on the other day? Wouldn't that epiphany also be a male counterpart of the notion of this particular jouissance, where although Lacan does not speak about this extreme notion of sexuality or a transcendental notion of sexuality for a man, but then it is possible even for a man to have that particular transcendental notion of sexuality, however in a sublimatory form, in an artistic form. That is the form that we are actually speaking of. The woman can more quickly actually attune herself to. Therein lies the very important potential or the possibility for the woman to have therapy. Actually, what we have done in our institution was we had begun we have just started conceiving a particular center, which is the Center of Well-Being, which was influenced by the Center of Well-Being, which has already been established in IIT Kharagpur. This Center of Well-Being, in this Center of Well-Being, we are trying to fuse notions of Zen Buddhism and at the same time psychoanalysis to give a sort of a therapeutic healing opportunity for these kind of particular traumas. Not only this kind of traumas, there are different kind of psychic traumas. It can be work pressure trauma, which might create a sort of a hysteria in different kinds of female. We had found, because of work culture traumas, same things are actually happening. But what I wanted to say is this sort of a healing has become very popular in the US and in European countries, especially in Europe, for women who are suffering from breast cancer traumas. But one thing has become quite clear now, but still there can be a lot of questions about it. Apart from the different kinds of filial notions or the different kinds of ideas of pain, one of the most important psychosocial notion of pain, however, is the distraction or the commutation of the notion of the other's desire for you. This may not be a very specific idea of the self, but then the entire community's acceptance of yourself as a feminine object of desire becomes distorted when once this anti-estrogenic problem starts working within that particular self, and adjuvant chemotherapy creates a problem within the self. Especially for this particular woman, it had gone towards an extreme condition when she actually suffered from complete breakdown and hysteria, which she had become completely unconscious of. At least her daughter narrated the entire incident to us. And then the mother started recollecting, yes, Madurai, this had actually happened to me, but I still don't remember all those things that happened. But she had convalesced herself from this psychological disaster completely by a sort of a therapeutic healing. She goes to mindfulness. She goes to mindfulness classes now, and she had completely tided over this particular form, the form of trauma. art therapy, music therapy, and at the same time therapies of performance can actually work to create that notions of jouissance, which is the other form of transcendental jouissance available to the men. In brief, this is exactly where I am going to end it without going into further complications. Okay, but again, I am saying this entire thing has actually cropped up within me out of a sort of a sympathetic and at the same time a subjective issue that I had to handle in order to give a sort of a mental peace to this particular girl of mine, and at the same time to the mother, more to that particular girl. And it was me who had actually sent this particular woman for therapeutic treatment in the form of well-being, and she had got definitive results from this particular well-being, after which Madurai had started telling me that it had done yeoman's service, your particular suggestions had done yeoman's service to my mother. So one thing has become quite clear to me, that perhaps my hypothesis was correct. Once this particular subliminary notions of psychosexuality beyond pain and notions of pleasure were sublimated, she had started healing. Now it so happens she is not of this particular figure anymore. She doesn't have hair at this particular moment, but I did not use that particular picture because she didn't allow me to do that, use that particular picture. She doesn't have hair on her on her head. Her body has become extremely emaciated. She has become extremely quote unquote non-feminine at present, but at least in spite of all this, she has got mental contentment, complete peace after she had made it a point to go to this well-being center almost every day for 15 to half an hour, which is a complete cure to her. She has no other trouble in her mind at present as far as our conversations go on, except for the fact that she sometimes laments that if I pass away, if my father passes, if my husband passes away, would you keep track of my daughter? She is the only daughter and she is going to be orphaned within a few days or so. Perhaps there was some sense in what I actually did. I think it is not entirely based upon a hypothesis. And what we could not understand Lacan was trying to project, this is one of the empirical evidences where Lacan has actually been proven in a practical form. With this particular note, I don't want to move on further. This is exactly what I wanted to say.